I welcome you all to today's episode of the Time with the Dietitian webinar series titled Heart Health, which is organized by the KNUST Wellness Center. My name is Abigail Kwating, and I'm honored to be your moderator for today's session. So once again, I would want to highlight that the KNUST Wellness Center, together with the whole university, this year we are focusing on reducing work-related stress. And so everything we are doing is around work-related stress, because in our demanding world and fast-paced world today, we need to know how to manage ourselves as far as stress is concerned, So stress can impact not only our mental and emotional well-being, but our physical health as well. So this month, last month and this month we will be going out with me. We started going out and we're still going out. And one of the things that the counselors we go out with stress on is the physical health, how stress can impact our physical health, because according to them, chronic stress can lead to increased blood pressure and even heart diseases. So we need to really focus on how we can reduce our stresses so as to prevent some of these things. Because when you are in your comfort zone or you are stressed, when you are stressed, there's this crave for comfort with regards to food. Your food choices, sometimes people get stressed and they tend to eat a lot. They tend to have some diet choices which are not healthy, So today, in fact, we have our acute dietitian in the person of Miss AFRAKOMA AMOAH, who will be doing justice to how we can make good choices as far as our heart health is concerned this afternoon. So I welcome you all once again, and I will leave the podium for our dietitian. So Afrak, the floor is yours. Your audience are ready. Can you take over?
Hello? Good afternoon.
Yes.
Hello, good afternoon.
Good afternoon.
So I'm glad to be here. Unfortunately, our numbers are low today, so you might want to invite someone to this afternoon's meeting. You don't want to learn alone. You want to invite someone to this afternoon's meeting. All right. Good afternoon once again, and I'm glad to be here. Myself and Wellness Center, I don't know if we can separate us. I'm part of Wellness Center now, and I'm happy to be here. So this afternoon, we want to talk on nutrition and heart health. And I believe it's something that is not new to us. We might have heard it very often. And I even remember last year, Time with the Dietitian, we treated this topic as well. So this afternoon, we will focus on this will be our outline for the presentation. We'll look at an overview of heart diseases, some symptoms, the causes, the risk factors, and heart healthy eating. And I promise not to bore you with a lot of explanations and technical terms this afternoon, but to make it very practical as much as possible. So before we begin, I want you to just feel your heart. Just put your hand on your chest. Sometimes it's even confusing the actual position of our heart. People say it's on our chest. People say it's on our left breast, that area. So just feel your heart. Any way you can feel your heartbeat. So you might want to take a minute and just feel your heartbeat. And can you feel your heartbeat? Please, I need someone to respond. Can you feel your heartbeat?
Yes, I can.
And I think if you don't feel your heartbeat, that means like you are dead. You're a dead person walking. And if you can feel your heart, what does it say? What is your heart telling you this afternoon? So I have two options here. So the option one is your heart is telling you, hey, thank you. We are doing just fine. The other option is saying, help, I'm dying in here and I want to come out. So which of these options belong to which of them will be the answer that your heart will give you this afternoon? Is it saying, thank you, I'm doing just fine, or help me, I am dying in here? And this responses is so because of basically our lifestyle, and we will take a look at that this afternoon. And so the other point I want to also raise is that we are more likely to take good care of the parts of our bodies that we see. So we can easily tell when our arms are hurting, our fingers are hurting, our legs are hurting, our head, our eyes, our nose, our mouth, our tongue, our teeth. I think we are able to really take good care of the visible parts of our bodies, but the internal organs are somewhat not considered because they are hidden, so we don't really see them working. But if we can actually pay attention to our bodies, all the organs are actually giving us an information one way or the other. Sometimes we ignore because we feel we are okay, and the most dangerous thing is they keep giving us the caution, I'm dying, something is happening, do something. But we ignore all their cautioning. By the time they explode, then we say, oh, when did this happen? It has always been there, and it has been announcing its presence or its danger or the hard feelings that it's having to us. The caution to us and the caution that our heart is telling us this afternoon, even as we are feeling it, is that our heart is telling us that when I stop, you stop. When our hearts stop, we stop. So help me to help you. That is what our heart is telling us this afternoon. When I stop, you stop. So help me to help you. And I believe that by the end of today's discussion, we'll be able to make an informed decision on how to take good care of our hearts. So the hearts we have is divided into two chambers. I don't want to bore you with the anatomy aspects, but we have the left side that takes deoxygenated blood to the lungs, then the right side that pumps blood to the various parts of the body. And we have valves in between these two chambers to make sure that the blood does not flow back to the preceding valve, or the blood does not mix up. So we can have there can be a smooth flow of both the deoxygenated blood and the oxygenated blood. So the deoxygenated blood is the blood that carries the waste, lack of oxygen and all the waste substances to the lungs, especially lack of oxygen to the lung for it to be oxygenated, then back to the heart for it to be pumped to the various organs in the body. And the heart is also connected to arteries and veins that helps in the supply of this blood. So when we talk about heart diseases are a range of conditions that affect the heart. So there can be a problem with a blood vessel, commonly is the coronary artery. There can be an issue with your heartbeat, irregular heartbeat. So you can have your heart can beat very fast or very slow. There can also be heart defects that are congenital. If we say congenital, that means it came like you were born with it. Let me put it that way. You were born with those defects, and it does happen. And you can have disease of the heart muscle as well. Then the heart valve, what I mentioned earlier, the valve that separates the chambers. There can be a problem with the valve, such that blood moving from one chamber to the other may be impeded because the valve might not close properly. Then there can be a mixed up of blood, and that can be very dangerous and very life-threatening. Then there can be heart infections as well. And it will surprise you to know that poor dental health can poor dental health can be caused by bacteria. So this bacteria can travel down to our heart and cause heart infection. So that can be something you should take care of. So when we talk about healthy living, all the organs in the bodies are connected in a way. And it's surprising how poor dental health can cause heart infections. So we need to take good care of ourselves. So you want to look at some symptoms of heart diseases. So the symptom of heart diseases depend actually on the type of heart disease you have. So all these symptoms might not be linked to a particular disease, type of heart disease, but these are the common ones. So there can be chest pain, shortness of breath, jaw in the neck or pain or throat. There can be pain, numbness, or weakness or coldness in the arms or legs. And this is a common example of a peripheral artery disease. So the particular artery that supplies, the particular vein or artery that supplies blood to the arm or the leg can be blocked, and this can lead to, that means there is shortage of blood to the particular part of the body, and that can bring about weakness and pain and numbness in that area. There can be dizziness as well, fainting, fatigue, um, heart racing heartbeat, that is tachycardia or bradycardia. So then that means there is a problem with the heartbeats. That's the arrhythmia. And there can be feeling of shortness of breath during an activity or sometimes at rest. Sometimes you might not be involved in any strenuous activity, just resting, and you feel that you are not able to breathe properly, or you are having like you're having chest tightness or chest pain. And also there can be shortness of breath at night when sleeping and or when you wake up. And there also can be weakness and fatigue. So these symptoms, as I said earlier, is not associated to all the types of heart diseases. Okay, so we move on to the causes of heart diseases. And one of the primary cause of heart diseases is what we call atherosclerosis. So atherosclerosis is just a buildup of fatty streaks in the blood vessel. So these build up. So if you look at the diagram, you realize that it moves gradually. So it doesn't start one time. It starts gradually, a buildup of um of cholesterol, of fatty, of fat. Then there can be an inflammation and influx of inflammatory cells that causes the artery to be literally blocked. So sometimes this plaque can rupture, like we see here, and this ruptured plaque, just pieces of it can be called an emboli, and these pieces can block another artery or can block another vein. So this is very serious and very life-threatening. So one issue with atherosclerosis being formed in a particular artery is that it doesn't just affect that particular artery. So let's say, for example, this plaque is being formed in the coronary artery. The plaque can rupture, and the emboli can clog another artery somewhere or another vein somewhere. So when that particular artery or vein is blocked, let's say the artery that supplies blood to the brain is blocked, that means that the area of blood supply after the block, that means there will be no area of there will not be any blood supply to the area after the block. That means that all those areas after the block begins to die because of lack of oxygen and also lack of nutrients as well. So this is very important, and sometimes too it can block the artery to the extent that the artery itself can rupture, and that can bring about bleeding and so on and so forth. So this is one of basically the main causes of heart diseases. And I must say that this plaque formation is usually due to our lifestyle, inactivity, and is also associated to age. It's also associated to age. So moving on, we want to look at some risk factors of heart diseases. So I mentioned age earlier. So age, sex, family history, smoking, blood pressure, high cholesterol, uncontrolled diabetes, and stress. So I'm glad that our moderator highlighted on stress leading to heart diseases. Stress has been shown to cause several diseases. So I think I believe the link to stress and heart diseases could be the increase in the high blood pressure resulting in the heart diseases. So then we should be mindful of stress and be able to adapt some measures to be able to control our stress. And I'm glad that the Wellness Center has been organizing some webinars on stress management, and that is actually our focus this year. So stay tuned for more updates on stress management. And then a focus on our discussion this afternoon will be on the unhealthy diet. So research has found out that diets high in fats, salt, and sugar have been linked to heart diseases. And this is very important because these three main should I say food substances, the fats, the salt, and the sugar, is linked to the high blood pressure, the uncontrolled diabetes, and the high blood cholesterol. So these ones are linked in a way. So if you have somebody who has high blood pressure, not controlling that will lead to heart diseases. And last month, when we studied nutrition and kidney health, we also realized that high blood pressure could result to kidney diseases. So these chronic diseases are actually linked in a way. Having one doesn't mean that you are free. Not being able to manage that particular chronic disease can bring about other health and serious health complications as well. So we want to look at some complications of heart diseases. So we have heart failure. Heart failure doesn't necessarily mean that your heart has stopped, like your heart has just given up on you. Sometimes people think heart failure means your heart is dead. That is not that is not the meaning. It just means that the function of the heart has been reduced drastically, such that an emergency is needed to treat it as soon as possible. There can be an heart attack, but and I know that is very common to us. There can be stroke. So there are two types of stroke. So we have the ischemic stroke and the hemorrhagic stroke. So the ischemic stroke is just a blockage in the vein that supplies blood to the brain. So when there is block in that particular blood vessel, it leads to death, it leads to brain cell death. That is how we call it. It leads to death in the brain cell. And every part of the brain controls the functions in our body. So our eyesight, our hearing abilities, our movement abilities, our ability to chew, swallow, ability to see, all our movements are controlled by the brain. So in the case of stroke, let's say the particular part of the body that supports movement, the vein supplying blood to that particular part of the body that supports movement is being blocked, such that there is no blood supply to that area of the brain. So that means that that area of the brain begins to die. And when that happens, it's automatically reflecting inability to move because that part of the brain that controls movement is dead. It can also be that a part of the brain that controls swallowing is being affected. That is why you can see a stroke patient, the person might not be able to swallow. The person can talk actually, but will not be able to swallow. You might see someone and half of the body is being paralyzed, but can move the other parts of the body. You might see someone and it looks like the the person has a drooling face, like the person's mouth has just shifted, and we see these people, and sometimes the unmature people will make fun of them, but it shouldn't be so. So it's just letting us know that the brain controls all the functions of the body, and any part of the brain that is being affected would inevitably affect any function that brain controls. And also there can be aneurysm. Aneurysm is just a bulge of a part or a bulge on the blood vessel, and it can rupture. It's just a bulge on the blood vessel, and this can rupture. And when it ruptures, there can be an internal bleeding, and that can be very life-threatening. And also there can be peripheral artery diseases. So the peripheries are our legs, our hands. So any disease in the artery can also bring about life-threatening conditions. So it means that our heart is very important, and taking good care of it will inevitably prolong our lifespan. So this afternoon, we want to look at healthy hearts. What is a healthy heart? And our discussions, we will keep our discussions as practical as possible. I don't want to bombard us with eat this, eat that, and I believe it's something we have heard over and over and over again. So this afternoon, just to reiterate what we have been hearing over, is that one of the ways to improve our health is a balanced calories with physical activity. I find patients asking me that, so should I eat a heavy breakfast or I should eat a light breakfast? Should I eat a heavy supper or I should eat a light supper? It's just based on your physical activity. So the first point is balanced calories, eating with physical activity. It's just based on your physical activity. If you know that this morning my activity wouldn't be that strenuous, why would you want to eat a heavy breakfast? Because in the end, you are not going to expend the energy. So I have a little mathematical calculation to teach you. So when energy intake is equal to energy expended, there is maintenance of weight. So if the energy you are taking in from our food is equal to the energy you're expending, then that means your weight is being maintained. However, if the energies you are consuming is less than the energy you are expending, that means less physical activities. That means that you are going to gain weight. And then if the energy you are consuming is less than the physical activity you are you are you are undergoing, that means that you are eating less but you are exercising more than, that means you are losing weight. So more energy, less expenditure, weight gain. Less expenditure, more less energy, more expenditure, weight loss, but equal energy, equal expenditure, weight balance. So that is the simple thing I want to teach us. And to improve our health, we need to engage in aerobic activities such as brisk walking. So the American Heart Association recommends 30 to 45 minutes of brisk walking 3 to 5 times a day. So that could be approximately 150 minutes of brisk walking a day. And I have patients saying, oh, I have a very active lifestyle. I climb the stairs during my workplace, I move around, I don't sit for long. But I always tell them that that has been your routine. And following that routine, have you observed any changes, any overall changes in your health? Have you seen any change in your weight? Is it reflecting in your weight? If it is not reflecting, then that means you need to add on. So I always tell people that irrespective of your daily activities, let's make time for this aerobic activity, 30 minutes, 30 to 45 minutes of brisk walking, 3 to 5 times a day. And then let's reach for a variety of fruits and vegetables. And I always say variety, and we always stress on the variety because different fruits and vegetables comes with its own antioxidants. And antioxidants have been shown to fight against free radicals. And these free radicals have been linked to the causes and the formation of a lot of chronic diseases, including cancers. So the different colors have their own different antioxidants present in there. So you would want to try different colors. So make your food colorful. You can have carrots, you can have cucumber, you can have pear, any vegetable you can add to make your food colorful. So the emphasis is on the color, And the number three is to choose whole grains. So when we say whole grains, is the grain with the oats attached, so with the fiber option attached. So the perfumed rice we have is not a whole grain meal. It's a refined, so we call it refined carbohydrates. So we the whole grains in our Ghanaian setting can be local rice, but the local rice, sometimes I have issues with it because I've seen local rice that they've taken the husk from it. So let's be mindful when we are buying foods or in the name of local products or in the name of organic products. Let's be mindful and be sure that we are actually going for whole grains as much as possible. So something like our wheat, our oats can be a whole grain. Our corn is a whole grain. And let's try and keep a balance of it. So if I'm saying whole grains, I want to expand it and add our tubers and our roots to it. So all these are what we classify as complex carbohydrates. So it's the complex carbohydrates that have the fiber in addition. And what this does in our system is that especially if we want to control our blood sugar level. So eating foods that contain a lot of fiber reduces it actually reduces digestion. So it prolongs digestion, and there is a reduction in the release of glucose from these foods because the fiber inhibits the assimilation of glucose into the bloodstream. And then that means that there is a gradual release of glucose into the bloodstream, unlike taking foods that do not contain fiber. It's quickly digested, quickly assimilation, then there is a rapid release of glucose into the bloodstream. So that is where we have the glucose spikes. Yes. And so eating foods that contain a lot of fiber reduces the rise in glucose level. And that can be a treatment and a 100% goal treatment in diabetes as much as possible. And then fiber has been shown to also reduce blood pressure and also cholesterol, particularly for insoluble and the insoluble fibers and the resistant fibers, especially found in potatoes and banana, is able to bind with cholesterol and excrete it from the body. So the resistance fibers are able to bind with the excess cholesterol in the body and is able to excrete them from the body. So that can be a remedy in promoting heart health. So we talked earlier that diet high in cholesterol, in fats and sugars has results in heart conditions, and that is what I've tried to explain the role of fiber in reducing the cholesterol level, in reducing the blood pressure level, and in reducing high sugar level as well in the blood. And in addition to controlling the blood pressure, most of the vegetables contain potassium, and potassium has been linked to improve hypertension in controlling blood pressure. Sorry. So potassium and sodium works in the opposite direction. As sodium is increasing the blood pressure. Potassium is reducing the blood pressure. So they act in opposite direction. So if you haven't high blood pressure, you would want to go in for foods that contain potassium, as this can help control the blood pressure. And I'm saying these things in context, as if you have any underlying health conditions like kidney issues that will not warrant taking in high potassium food. So I'm saying this in the context of somebody who doesn't have any other comorbidity. And the fourth thing is to look at including healthy protein, emphasis on healthy protein. Usually, I find patients telling me, Madam, I'm eating protein, but you go and check and it's not protein, it's fat. So whenever I have the opportunity to give nutrition education, I always say that go for lean protein. Go for lean protein. There is a clear difference between fat and protein. Let's not exchange fats for protein. If you go to the market and you buy beef, if you are not careful, what you'll be given is actually fat and not beef. It's just a small portion of the beef coated with fat. So when you come and you say, "Oh, Madam Dietitian, I'm eating protein," you're actually not eating protein. So we find people in an attempt to eat protein, they end up even increasing the total fat calories they are supposed to take in a day. So let's be mindful of that. Let's go for lean protein as much as possible. Include a lot of plant-based protein, our legumes, our beans, our nuts, our seeds, flax seeds, sesame seeds, almonds. These are healthy cashews. These are healthy nuts and seeds we can go for. And then I would also talk on um, our fish, our fishes, our eggs, our meats, our chicken, making sure that we are going for lean poultry. So we don't say poultry, but lean poultry. If we say lean poultry, that means that the skin of the poultry is being taken off, and that would help us because research has identified that it's not really about the cholesterol present in foods that causes the heart diseases we find. So we have people being afraid their cholesterol phobia. So they say, "Oh, I don't want to eat cholesterol. Oh, it contains cholesterol." But research has found out that it's actually high saturated fat that has been linked to heart diseases. So an example of the saturated fat is the fat around the poultry, the visible fat around our meats, the offals we have. So I have problem when people say offals are protein, yamade, as we call yamade. I stand to be corrected, though maybe the food scientists and the biochemists can help us. But I think that when we pick the offals in general, the yamadia we say, apart from the liver, I might single out. Basically, what we have is more of fat than protein. So let us not lie to ourselves and go in for this option. Make sure that we're going for fishes, our eggs, lean meat, lean poultry as much as possible. And talking about fishes, the American Heart Association has also recommended that we need to take oily fishes, as these oily fishes are contain omega-3, and this omega-3 has been found to reduce inflammation and also produce heart health. So we see that it's a heart healthy nutrient. Omega-3 is a heart healthy nutrient. So when we talk about fatty fish, we are looking at tilapia, we are looking at our salmons as much as possible. So let's go in for these foods. And talking about milk, let's make sure that we are going for low fat milk as much as possible. People complain of the taste of the low fat milk, but let's try as much as possible to go in for the low fat milk, as it is low in the saturated fat as much as possible. And then we will move on to our fifth point, talking about oils. So with the oils, let's go in for our vegetable oils. Our vegetable oils. So there has been concern lately of coconut oil being the ideal oil for us to use, but I didn't include that in the slide, but some analysis on oils were done, and it was even identified that groundnut oil groundnut oil had lower, I repeat, lower, so I didn't say no. So groundnut oil had lower concentration and percentages of saturated fat and unsaturated fat as compared to the common oils we have. And so I mentioned earlier that we should go in for the vegetable oils. But mind you that these vegetable oil excellent options being the canola oil, the olive oil, are not able to withstand high application of heat. And as such, cooking with these oils for a very long time end up increasing their levels of saturation. So we might think that we are using a healthy oil, but by the time we are done cooking, even if we had gone for the saturated oil in the first place, it would have been better. It would have been better. So when we talk about the saturated oils, I've given examples, the saturated fat, sorry, I've given examples being the fat around the poultry, around the vegetable fat around our meat, and also the oils that settle at room temperature. So somebody will rightly say, oh, palm nut oil. But I always say that palm nut oil comes with an additional benefit of vitamin A. So if you're using palm nut oil, you have an additional benefit of vitamin A. And I've seen some oil, some fortification of some oils with vitamin A as well. Then moving on to the sixth point, let's try and avoid highly processed foods. Highly processed foods like pastries, our fries, and so on and so forth. Because these contain a lot of saturated fats and even trans fats. And then the caution, another thing we need to be conscious of, our seventh point, is to be mindful of added sugars. Let's be mindful of added sugars. Sometimes, especially with the packaged foods and the processed foods, you might think that, oh, you are taking in a fruit juice, or you might taking in a particular food or whatsoever, but we will go on to the food label. You realize that you are actually taking added sugars apart from the sugar present in the fruits, or in the fruits that was used to make the fruit juice. The rest of the additional carbohydrate they've stated is just added sugars. So you have literally not taken anything in a sense. It's just sugars you've taken. Yes. And then, so we need to be mindful of that and look at our food labels when we are buying things from the grocery store. So let's cut down on salt as much as possible. We will look at the recommendation for salt, and also as much as possible limit alcohol intake. If you don't drink, don't drink. If you drink, reduce it. Then the 10th point is do all this wherever you eat. That means that in whatever food you find yourself eating, let's ask ourselves these questions. Am I eating whole grain? Is my protein a healthy protein source? Is this a saturated fat or unsaturated fat? Can I go for the healthier option rather than this? Let's be mindful of these things and ask ourselves these questions, particularly when we eat outside. When we eat from the restaurant, you might want to choose from foods that have low salt, low fat, low sugars as much as possible. Preferably, let's go in for these options. So I just brought this for us to just have a look at how we can identify sugars and salts and then trans fats. So let me go back to to this slide for us to just have an overview of what the recommendations are. So it's been this is the recommended dietary allowance for an adult. So it's suggested and it's being recommended that saturated fat should be less than 10% of the total calories. Other recommendations go further to say 10% of the calories for fats. Yes, and that could be something that might not be very relevant for us to calculate. Maybe you might want to see a dietitian for the person to be able to estimate your the total calories for you, the calorie you need in a day, and be able to find out the exact amount of saturated fats you are allowed in a day. And then for sodium, the plan is to aim at less than 2,400 milligram of sodium in a day, and that is less than 1 teaspoon. And this is something that is woefully impossible to achieve, less than 1 teaspoon of salt a day. I believe the day is not even ended, but if you want to recall the food you took for your breakfast and your lunch, clearly you might even exceed the 1 teaspoon of salt per day. So this is something that is not very possible to achieve, but yet it's possible. It's possible being that if you are reducing your eating out, if you are using natural spices instead of artificial spices that comes with added sodium, you see, if you are doing these things, if you are reducing your usage of processed foods and going in for the raw foods as much as possible, then we can say we are nearing at least the 1 teaspoon. Even if we are not able to achieve the less than 1 teaspoon, we can say that we are nearing the 1 teaspoon, and that should be something we should aim for. So if we are reducing eating out, if we are using more of natural spices than the artificial ones, because the artificial ones comes with added sodium and even higher compounds of sodium like the monosodium glutamate. And if we are reducing our intake of processed foods, canned foods, especially if we are reducing our intake of these things, it helps to reduce the total amount of sodium we are eating in a day. And then again, talking about added sugar, so the American Heart Association suggests a stricter added sugar limit of no more than 100 calories per day. And this is about 6 teaspoons for most adult women, and no more than 150 calories per day. That is about 9 teaspoons for most men. But so we will talk about the practicality of this in the next slide. So let's say in a day you are supposed to take the recommendation is 6 teaspoons of added sugar. Already your breakfast about 2 teaspoons of this is a teaspoon, the smaller spoon. It's not a tablespoon. This is a teaspoon, the smaller spoon. So if your breakfast you took about 2 teaspoons, already 2 is gone. It's left with 4. Mind you, there are already occurring, like naturally occurring sugar in some of the food we eat, especially our foods. It comes with a naturally occurring sugar. And then again, let me go back to mention the sodium again. Some foods also comes with a naturally occurring sodium. So that is why we want us to, as much as possible, reduce the ones we are adding onto the ones already existing in the food. Because if we are able to reduce the ones we are adding, then we can achieve the balance. So coming back to the sugars, if we have a recommendation of 6 teaspoons of sugar in a day, and your breakfast you already took 2 teaspoons, that means you are left with like just 4. Then in the afternoon, you will go for a fruit juice that has about 24 grams of added sugar. You've already exceeded your recommendation for your recommendation on the sugars in a day. Then in the night, you want to go in for another sugar, or you want to go in for a coffee and add sugar, or you want to go in for a beverage, you're going to add sugar. So we see by the time the day is over, Now the day is over. We have exceeded our limits for added sugar. And when we talk about added sugar, honey is part of the added sugar. So let's not limit ourselves to just the table sugar, whether brown sugar, purple, pink, whatever sugar is sugar. Honey is inclusive. Honey is inclusive. So let's go back to our uh, food label to just have a look at it. Please, if I may, is it visible? Are you okay? I'm trying to enlarge it for us so we can see it. So this is a nutritional label of a sweetened tea, and they are saying that it contains 70 calories. That means energy, 70 energy in this tea. And this is per serving. And the container contains 2 serving. I don't want to really explain all these things to you, but it's just an overview for you to have and appreciate it, so that when you get any food label, you'll be able to at least make meaning out of it. So this is just telling us that if this energy we see here is per serving and the total container contains 2 serving, then what's the total energy in here? Please, can someone help me? Simple mathematics. Hello? Hello?
Hello?
Hello? So please, I asked a question. So if this is the total energy in this bottle or in this food product, and they are saying this energy is per serving. Per serving is 70 energy, 70 calories. So if this bottle contains 2 servings, what is the total energy in this bottle?
It's 140, please.
140. Thank you. So this means that whenever you get any food product, if you have any food product on you, you can just pick it and just look at it. If we say the energy is usually per a particular quantity, the energy indicated here is not the total energy in the whole container. Usually, some products give per 100 gram of it, per 100 gram of the content. So if this is the total energy, you would want to ask yourself, how much is the serving? So if we say a serving is just an amount of food or any product that its energy or its nutritional value is being known or has been found out. So you would want to make a lot of calculations in your mind as you go to the market and buy your food. So you'll see that there is another column for total fat. Then we have saturated fat, trans fat, cholesterol, like that. So thankfully, this product we have doesn't contain saturated fat. But if you pick a product, you would see the total fat here. You will see the saturated fat and the breakdown of all these things. So the percentage value you see here is just informing you of the total percent with corresponding to like your total calories. And usually the the general calorie they usually use is 2,000 calories. So for instance, if this if saturated fat here was about 10 calories, 10%, then that means you have achieved your 10% for the day. What we looked at earlier, the recommendation, you would have achieved your 10% for the day. So you might want to pay attention to the percentages that are written here for you as you buy any food product. The percentages here is just telling you the amount you have consumed in a day. So if you see 10% here, you have achieved the 10% recommendation. If it was 5%, that means you have an additional 5% to go for. And then I want to look at the sodium. So sodium here was 10 milligram. That means that if you consume this bottle, if you consume this total bottle, you are getting 20 milligram. Then you would want to make the subtraction from your sodium intake for the day. Please, I hope you follow. So you want to make the subtraction from the total sodium intake in the day, being the 2,400. Then you know the additional ones you have left. The other thing, the last thing I would want to look at is the added sugars. So when you any product you get, we have the total carbohydrate stated here, and they will go further to break down the carbohydrates for you. So you would see that you will see the portion for the dietary fiber. So this particular tea doesn't contain fiber, and we just talked about the importance of fiber even in controlling blood pressure, blood cholesterol, and blood sugar level. So you might want to go for foods that have a higher dietary fiber percentages if it's a processed food. Then what I want to focus on again is the added sugar. So let's look at this. It has stated that includes 18-gram added sugars. So there and there, you just make your subtraction of the total amount of sugar you have to take. And this thing stated here is then again per the serving. So it's just telling us that per serving of this product, you have 18 gram. So if you are taking the total product, you are getting about 36 gram of added sugar. And that means you've even achieved or even exceeded your recommendation for added sugar in a day. But this is just a beverage someone will take as a snack. Meanwhile, you've already taken breakfast, you added sugar. You will take a fruit juice that has added sugar. So by the end of the day, we have exceeded our recommendations. And that is something that skips most of us. And that is something that we don't usually pay attention to. But that is what has been found to be linked to all these heart diseases. So let us be mindful of these things. And if we are not clear on anything, you can just walk into the wellness center. There is a dietitian here. Just ask questions about it, and I believe it will help us. So I believe I can pause here. The next slide is just a video for us to just watch. So I believe I will pause here, and if there are any questions,
Okay.
we can take the questions. Thank you.
You are welcome. We are clapping for you in our heads. This is good. In fact, what you just explained, it's very, 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 very good and important that we are mindful the things we are taking in.
Yeah.
My mother would say, my mother Pofodro would say, you have to be intentional about the intake of things, about what goes into your body. So we have heard a lot, and I believe we have a lot of questions for clarifications and other things. So the floor is opened. If you have any question or contribution, you are welcome. Our time is far gone, so we will do this as quick as possible. Thank you. Please, if you have a question, you can raise your hand in the chat or unmute yourself and ask your question.
Okay, please. My question is on the wheat. There's this woman, I've not researched much about her, but I've seen some of her videos on TikTok, and some people also share some of her videos on WhatsApp. I saw one of her videos on wheat, talking about the wheat we have nowadays containing a substance called amylopectin, and that one contributes to it has a lot of starch, and it contributes to high sugars in the body. So I would like to know if it's still good to be taken in more wheat, or if there's that original wheat that doesn't contain that, because according to it, the wheat has been hybridized. We have a hybrid form of wheat, and that contains that substance I'm talking about, amylopectin. So if there's any advice or any elaboration on that, thank you.
Okay, thank you. Please, I think we can take a lot more questions than I would answer, or we would want me to address as and when they ask the questions.
Yes, you can answer this one.
Okay, so
wait for others to prepare.
okay, so I don't think that the amylopectin present in the wheat is a cause for concern. It's just so the amylopectin is just a type of starch. Let me put it that way so we can better understand. It's just a type of starch that is present in foods. Yes, so we have amylose and amylopectin. So it's just a type of starch that is present in food, and it's just responsible for the stickiness of it. So you see sometimes you cook rice and it looks like it's stuck together. That is the work of the amylopectin. That's basically the function. That is why sometimes you cook wheat and it's as though it has become like a jelly-like thing. Yeah, but usually we have some how should I put it, like an already prepared amylopectin that people usually add to it when they are processing it. Yes. So wheat might not have like larger amounts of the amylopectin, but depends on the actual wheat you bought. Maybe it's not the one they sell in the market, but this has been a pre-packed, so they could add an additional starch to it just so that when you cook it, it becomes sticky. Yeah, but wheat in itself, when you cook it, it doesn't usually become sticky. Yeah, so maybe they have added it to the production, but it's not really so much of a health issue, because the amylopectin is even present in rice, in wheat, in maize, in root tubers like potatoes and cassava. So you see, when you cook cassava, the when you are trying to throw away the water after cooking, you realize that it has become sticky. That's what makes it sticky is the amylopectin. So it's not really it's not a fiber. Let me put it that way. So maybe the person is just trying to say it's not a fibrous substance. So taking it wouldn't be helpful, but it's present in the food. That is what I want to say. And the food contains fiber. So when you eat it, there's the fiber that really works. I mean, it's the fiber that the body that will be of importance to the body. I don't know if I've actually answered.
Okay, I get him.
So the amylopectin is just a form of starch present in the food.
All
And
right,
the different
thank you.
starches as well. They are resistant starches. So it's just a class of starch present in the food. Thank you.
All right, thank you.
Okay, thank you. Please, is there any other question, please?
Yes, I had raised my hand.
Oh, great. Oh, great. Prof, please, let's hear you.
Yes, I just wanted to add to what the presenter has already said,
Sure,
that the amylopectin, when you take starch has amylose and amylopectin. That makes the starch. So depending on the variety of grain that or whatever commodity you are dealing with, one may be higher than the other. The two make 100%. Okay, so we have amylose and then the amylopectin. But I think what the person is asking, probably we've realized that wheat, especially the refined wheat flour, has high glycemic index. So maybe that is what the person is referring to. It has high glycemic index because it's refined. But then if you're using the unrefined wheat, that is more nutritious or more healthier to take as compared to the refined wheat. Then this is just contribution. My question is that the palm kernel oil and then palm oil, our local oils, are they healthy for us or not as compared to the ones we have on our markets? You know, there's so much oil varieties on the market now that even the so-called olive oil, nobody knows whether it's really olive oil or not. So what would be your advice for us? Thank you. And then, sorry, the last one, age. You said age, the heart diseases and all that, heart challenges. How do we manage it? Because age, we can't run away from it. So how do we manage it as we age?
Okay.
Yeah, thank you.
Welcome. Thank you also. So thank you, Prof, for the addition to the wheat. So that would suggest that we need to go for the whole grains, as I mentioned earlier, and not the refined ones. So, and talking about the palm kernel and the palm oil we have. So during the presentation, I made mention of the palm oil that there has been like a negative tag on it, being that truly they both are saturated fats, we know, but they come with added advantages. So the palm oil, for instance, has higher concentrations of vitamin A. So that is a higher option. But I must say that no matter the oil you use, the ideal thing is the quantity. So no matter the oil you are using, whether even you are using American-made oil or wherever the oil is coming from, the caution is on the quantity you are using. And then again, changing our methods of cooking. So this could be a healthy oil, but taking in more than you are supposed to is inevitably going for the bad oil. The effect is just the same. Or you are using the good oil, but you are increasing your intake of fried foods, oily foods, you are still going back to these heart diseases. So the caution is that no matter the oil you are using, the quantity is very important. So coming back to the palm oil, I mentioned vitamin A. Then the palm kernel oil too has been found to contain some antioxidants that help with aging. So it has been found to have an anti-aging compounds in there, and it also has some good fatty acids that are even essential for mental health as much as possible. So you see, but these oils also are saturated oils. So we can go in for it, but then variety comes in play. Variety comes in play as much as possible. Today is that, tomorrow is that. You are changing your methods of cooking as much as possible. And talking about aging, so I mentioned the formation of the plaque in the blood vessels that could cause heart diseases, and this has been linked to age. Naturally, as we age, apart from the unhealthy lifestyle, increasing the plaque formation in the arteries, aging has also been found to increase the risk of the plaque formation. So what we need to do is exercising more as we age. We should involve ourselves in a lot of physical activities, avoid sedentary lifestyle as much as possible, because aging in itself comes with its own health issues we can't control. But adopting a healthy lifestyle, eating healthy from now, really slows down the progression of a lot of diseases, because we see that almost these chronic diseases are age dependent. You can literally not escape in a sense, but you can escape when you have a healthy lifestyle earlier in your life. So as much as possible, let's adopt a healthy lifestyle, taking into consideration all the things that we mentioned here, adopting a routine physical activity, joining a gym, going for walk, joining a group of people for walks. I know the wellness center have I think it's weekly Saturday walks. So you might want to make good use of this opportunity just to stay healthy. Just to stay healthy. Because I know of people who are past 70, 75, 65, but do not have any chronic disease. And it is true. We can go in that line. It's not certain that so far as you age, you run into this chronic condition, even though age plays a role, but our lifestyle as we age also either progresses it very faster or slows down the progression of these diseases. So please, that will be that. If there are any more questions,
Thank you.
you're welcome.
Okay, great. So if there are no questions, then we would want to draw the curtains. And once again, as I said earlier, the Care University Wellness Center exists to make sure we are all well, simply put. And so we have our services, we have the nutritional counseling, we have the psychological counseling, and we have the gym services. Kindly find us at the former Hill and Hattie building, adjacent to the poolside. Come find out all the things that you need to know. You can also come in, walk in and meet a dietitian and talk to her about all your needs, your dietary and nutritional needs, and also book an appointment with us for a psychological counseling if you are having any psychological issues. Okay, so we would want to thank our dietitian, my own AFRAKOMA, for her teachings this afternoon. In fact, we've learned a lot. For me, it is the food labels for me. I really have learned so much, and we need to all be careful the thing that we take inside our bodies. And so we would want to thank you so much for everything you've taught us this afternoon. And we will continue to preach health and wellness to all people. On this note, see you next month, the second month of August. We shall meet here, same place, same time. Okay, have a nice afternoon and have a blessed evening. Bye.